You open the head up and you see the brain on a daily basis. And that's beautiful and it's fascinating. Whatever the color of your skin is outside, whatever your caste, creed, religion is, it just looks the exact same.
Today we are gonna dive into one of the most mysterious part of the body, the brain. We all know it controls thoughts, emotions, and organs of the body. But how much do we really know about the brain?
There is so much of untapped potential in the brain that we are still able to harness. People who are able to astro travel and people who are able to channel other people.
We have Dr. Mazda Turel with us, who is a brain and spine specialist.
You're not supposed to be on your screen at 2 o'clock in the morning. That's a great disservice to the human mind. You must sleep in absolute darkness. You know, some people have the habit of having a diya, having a 0-watt bulb. Any amount of light interferes with your sleep function.
Why does migraines and headaches happen?
If you have a dull aching headache that's not going away in 1 or 2 weeks, I would recommend doing an MRI of the brain. You can have a tumor on the left side, but you can have a headache on the right side. So that's one common cause of a brain tumor.
This startup by Elon Musk, which is Neuralink, is it great for human things or is it ethically wrong?
I think it's genius and it's intense amount of dedication and hard work to be able to come up with this. The ethical dilemma.
What are the surgeries that you particularly operate patient being awake? Humans only use 10% of their brain. Left-handed people are more creative. If you want to educate everyone about one thing regarding the brain, what that would be? Today we are gonna dive into one of the most mysterious part of the body, the brain. We all know it controls thoughts, emotions, and organs of the body. But how much do we really know about the brain? You may have suffered with migraines and headaches, but do you know that your brain can't feel the pain? Well, that's why we are here today. Why does migraines and headaches happen? What are the secrets the brain are holding? For them to answer that all, we have a neurosurgeon with us who is a brain and spine specialist. So this is going to be a really special episode, guys. We have Dr. Mazda Turel with us. How are you, sir?
Hi. Pleasure to be here. Great.
You've just rushed through the traffic.
Yeah, crazy traffic and 1.5 hours to get here. But looks good. I'm happy to chat with you.
You're coming straight out of hospital?
Straight out of hospital, yeah.
But it must be a hectic day for you.
So every day is hectic, but it's fun.
Right. So for the audience, we'll just start with very, very basics. What is neurosurgery and what does a neurosurgeon do? And then we'll dive deep into these topics.
So neurosurgery is the study of the brain, spine, and peripheral nerves of the body. And as you know, the brain is the master organ that controls the body. A neurosurgeon deals with medical and surgical conditions of the brain and the spine, the commonest being brain tumors, vascular problems of the brain such as aneurysms, arteriovenous malformations, obviously head injuries, strokes, and all sorts of spinal conditions that range from neck pain, back pain, degenerative conditions of the spine, what you typically call slip disc or sciatica or herniated disc, spinal tumors, spinal infections, spinal trauma. That encompasses more or less the spine part of the conditions that we treat. And then there's an entity called as functional neurosurgery, which deals with conditions such as Parkinson's, where we do things like deep brain stimulation. So that's a whole different basket of neurosurgery. Is becoming exceedingly specialized. And
So how this is different from neuroscientist?
so a surgeon is somebody who operates on the brain. A surgeon is someone who physically opens up the head, either minimally invasively, robotically, or but messes with whatever is going on inside, either in the brain or the spine. Whereas a neuroscientist primarily focuses on research, And a neurophysician or a neurologist is somebody who treats these conditions medically. A lot of neurologists also do some form of intervention, such as endovascular treatments of the brain and spine are occasionally done by neurologists as well. Certain pain modalities are done by neurologists. Certain neurologists give Botox treatments, not to enhance your face, but Botox is given for conditions like hemifacial spasm, spasticity, and several others.
Correct. So, what do you get the most patients for that particular disease? Is it Parkinson or is it the spine, or what's the most patient in your clinic?
So my practice is 50-50. 50% of patients have brain problems and 50% of patients have spine problems. In the patients who I treat with brain problems, primarily most of them have brain tumors. Brain tumors are two kinds. One is benign and one is malignant. 50% of brain tumors are benign, 50% of brain tumors are malignant. Benign means not cancerous. And in spine, we treat the whole spectrum of spinal conditions, right from the top of the head to the bottom of the bum.
So, is it like a particular disease, like let's say Parkinson or let's say epilepsy, which deals with your usual pattern of the patients?
So, a lot of patients comes with symptoms, right? So, when I get referred patients who are already diagnosed primarily. So, if a patient comes with a brain tumor, then they most probably require surgical treatment, and that's what we deal with. Patients who come with headaches, who don't have a scan done, they may have migraines, they may have tension headaches, cluster headaches, the whole spectrum of headaches. There's a big classification. So we deal with those. Parkinson's primarily is dealt with by neurologists or neurophysicians who most often treat this with medication. When it reaches a point where, let's say, medications are either not enough or causing side effects, or a patient is a candidate for surgical intervention, then they're treated with something called as deep brain stimulation or MRI guided focused ultrasound, depending on what the patient characteristic is. And then we have an entire team in our hospital, and a particular different person deals with that particular specialty.
You mentioned deep brain stimulation for Parkinson's patient. What is deep brain stimulation?
Deep brain stimulation is a condition wherein which you insert certain electrodes in a deep structure of the brain responsible for causing the tremors primarily in Parkinson's. Parkinson's is a condition which causes some shakiness of the hands, tightness of the body, slowness of movements. So when you have tremors, we are able to put in electrodes in a specific nucleus of the brain, and then you connect it to a battery in the body, and then you can program it from a computer outside, and that gives a current in that particular nucleus of the brain, and that's able to mitigate the tremors substantially.
And is that DBS, what you said, deep
That's
brain
DBS,
stimulation?
yeah.
Is it just used for Parkinson's?
It's the scope of DBS is now being expanded to a lot of other conditions. It's also used for anxiety, used for depression, used for obsessive compulsive disorders. I don't know, in the future someone might use it for erectile dysfunction also. But they're expanding the scope. Like for many other conditions, we're able to see that most of these are chemical alterations, and by stimulating certain areas of the brain, you can get these chemicals to work in the right balance.
So do you do this deep brain stimulation procedure with the patients awake?
Yes, we do them with the patients awake.
So just like I mentioned at the beginning of the podcast, that the brain doesn't feel pain by itself.
Correct.
So would you like to expand on that? Like why people get migraines and headaches when the brain can't feel the pain?
So the pain is felt by various other structures of the head, not by the substance of the brain per se. Let's say the skin is pain sensitive, the bone is pain sensitive, the covering of the brain, which is the dura mater, that is pain sensitive. The lining of the blood vessels of the brain, those are pain sensitive. So migraine is primarily a blood vessel problem that causes an unusual vasodilatation and vasoconstriction. When there's a stretch on the fibers of those vessels, that's what results in pain, primarily in migraine. But there are many other theories and technicalities. Is everyone will stop listening to us.
That's right. Coming back to another one rather than Parkinson, when we talk about the coma, so I just want to ask, what actually happens to inside your brain when you are in coma?
That's a deep and intriguing question. Now, the cause of coma can be multiple. Coma essentially means a lack of awareness or a lack of consciousness in some sense. A patient is not aware of his or her surroundings and is not responsive to, let's say, a deep sense of pain or any other forceful stimulus. So the causes of coma can be metabolic. Metabolic means related to dysfunction of electrolytes in the body, or blood sugar can be extremely low, and that can cause that. You can have carbon dioxide or carbon monoxide poisoning that can result in a coma, or you can have a structural injury. Like you can have a head injury and a patient can be in a coma. You can have a massive hemorrhage inside the brain and a patient can become unconscious. You can have a fulminant infection of the brain and that can result in a coma. So the causes of coma are multiple. And the basic underlying problem is that there is complete lack of awareness by the patient. So the patient doesn't really feel or understand or is aware of anything that is happening around when they're in a coma. Though you've heard exceptionally rare stories of people coming out of a coma and then narrating everything that they've seen and felt. But those are extremely unusual cases and nobody really understands the mechanism of that.
You said the patient's coming back from the coma. So why is no one been able to decode this yet, that once you go into the coma, what is the kind of a recovery period or whether the patient is going to live or not?
So again, it really depends on the cause. Let's say if someone has a blood sugar of 30 and is completely unresponsive, you give them glucose IV and they'll wake up in 2 minutes. So if a patient has a head injury and the patient's gone into a coma, it really depends on the extent and severity of the injury, which will determine whether they'll really come out of it. So it depends on what underlying brain damage has happened to the nerve cells and other structures of the brain that are responsible for arousal, consciousness, and primal functions of the brain will determine whether a patient can come out of a comatose condition or not.
So does this mean the doctors can give at least to say that the patient is going to live or not, whether he's going to come out of the coma or not, or even that cannot be said? Let's say in a serious case like head injuries, as you said.
Again, it's very varied. It's case to case. So in certain conditions, you can predict it. In certain conditions, you can't. If you have a condition called as a subdural hematoma, where a collection of blood causes pressure on the brain, patient's unconscious, on very many occasions, you just put a hole in the head and drain the blood and patients wake up instantly. So that's one entity. But if a patient has a deep-seated hemorrhage inside the brain, in a deep area of the brain, even if it's a small hemorrhage, sometimes they won't wake up for many, many weeks or months, or remain in what is called as a persistent vegetative state.
What is that?
Like you've heard the common term that people say, oh, will he be a vegetable after, will he survive like a vegetable, where they may be minimally conscious, but may not be able to communicate or may not be able to carry out any of their functions of daily living without the support of being fed by a tube, without a urinary catheter and all those things.
They're not conscious.
So they may be conscious or minimally conscious. There are many, many technical terms that are being used now. But for a general population or a general man listening to this, the differences are very subtle.
Correct. So coming out from coma, when you're a professional surgeon, so how does it feels like to hold the brain in your hands?
So technically you don't really hold the brain, but you open the brain, you open the head up and you see the brain on a daily basis. And that's beautiful and it's fascinating. And whatever the color of your skin is outside, whatever your caste, creed, religion is, whatever your social stature is, it just looks the exact same. Whether you're a worker sweeping the floors or you're Mukesh Ambani. I haven't operated on Mukesh Ambani, but I'm just. But that's the beauty, and you have the ability to treat conditions of the brain. You're able to remove large tumors from areas of the brain that once were thought of as inapproachable, and you're able to give patients back their quality of life, and that's really rewarding.
So you've been operating on brain since long, but does it still fascinate you like you
course.
did for the first time?
Of course, every day there's something different that you see. There's something different that you learn. There's a different feel to tumors. There's a different amount of bleeding that happens. Every tumor has a different texture. So it's always very, very fascinating and very challenging. There's never a dull moment.
Which is the most fascinating part of the brain for you?
I mean, to look at the surface of the brain is beautiful because it's got these grooves called sulci where blood vessels flow into them, and under the microscope you can actually see red blood cells flowing, and you can see veins and arteries merging with each other, and it's under a glistening field of what is called as the arachnoid, which is like a spider-like web that covers the blood vessels, and these are beautiful, intricate sites that are amazing to look at. And then when you go deeper inside the brain, the structure of those things changes to a more compact and a more dense environment. So, but the surface of the brain is magnificent. It's really beautiful to look at.
So a lot of people still confuse between the brain and the mind.
So the brain is a structural substance, something that you can see physically. The mind is what everybody else on Instagram talks about. It's the part of the body that the part of the brain, or you don't even know if it resides in the brain. It's that part of the human consciousness or the subconsciousness that makes you think and feel and behave the way you are.
Correct.
So I think it's a very vague term.
I would share one of my story. As I said, we are discussing the daily life with the lens of neurology. Do you know Yuval Noah Harari? So, okay, I was watching his podcast with Beer Biceps. It has been recently released. He was talking about a lot of brain stimulating things. This was like 2 a.m. in the morning, I could recall. My brain
We're recording this at 1 o'clock in the morning after a whole day's of work.
So at 2 a.m. in the morning, my brain got so stimulated that I couldn't sleep until 9 a.m. It got me so much thinking, even I could not stop thinking. So like when your brain stimulates so much, what is exactly happening inside the brain, like with the chemicals and the functions?
Yeah, so obviously you're not following what is called as the circadian rhythm of the body. First of all, you're not supposed to be on your screen at 2 o'clock in the morning. The blue light of the brain really affects the retina, and then eventually has a rebound effect on certain chemicals in the brain that interfere with the secretion and outflow of melatonin, which is responsible for you to fall asleep. So if you are overstimulated at the wrong time for the wrong reason, obviously you're not going to get sleep. And that is why you need to, if you really want to sleep well, you need to get off all devices post dinner as far as possible. Through the evenings, wear a blue filter on your glasses so that they're not getting overstimulated. Before you plan to sleep, get the lighting in your room a little dim. And the current recommendation is that you must sleep in absolute darkness. You know, some people have the habit of having a diya, or having a 0-watt bulb, or having all of those things. But any amount of light interferes with your sleep function. So now the whole world is on Instagram at 1 o'clock in the morning, right? And watching podcasts, and we are recording it at 1 o'clock in the morning. So imagine there's enough people seeing it at that time. But I think that's a great disservice to the human brain and the human mind. We should live traditionally and try and wind down our activities, ideally post sunset. But that's in our day and age, it's not possible, but preferably post dinner. Be a great idea to go for a little stroll after dinner, and then probably read something to bed rather than watch something on your screen.
You mean to prepare the mind for sleep, basically a routine.
Yeah.
But coming just a last question on that particular topic. Does particularly if I talk about the stimulation, even though it's in the daytime, does stimulation cause lack of sleep? Overstimulation of your mind?
Yeah, of course. I mean, any kind of overstimulation is going to interfere with the toning down of whatever the mind is doing or whatever the brain is doing to fall asleep, right? So any kind of activity, either whether it's sound or whether it's light or whether it's any external stimulus, or even for that matter, an internal stimulus where you're overthinking, you're not allowing the brain to do its function to help you go back to sleep. Because sleep is extremely important in nourishing the brain to prepare for the next day. And that's why, people who have really erratic sleep patterns, or people who are forced just by their call of duty, let's say people who work night shifts, people who work in the airline industry, they have issues with brain function. Not all of them.
Correct.
Some of my friends do.
Okay. Do you meditate?
I mean, I consider my work as my meditation, which is my excuse for not formally sitting in silence for a couple of minutes a day. As a child, I went to a Vipassana course when I was 18. I never really stuck to it. Did a little bit of it in COVID. But I think one must meditate.
I mean, like the Vipassana that you said, are you still doing it?
No, I don't do it on a daily basis. Whenever I have the time for 5-10 minutes, I just close my eyes and focus on my breathing when I'm sitting in the office. But apart from that, I don't have a strict ritual where I wake up in the morning and spend half an hour meditating or in the evening. But I think it's extremely essential for people to meditate, because now, once upon a time, we were just told that our meditation is good for you, so do it. But but now we have enough data and science to tell us that it works really well. Meditation reduces stress levels by actually reducing the cortisol level in your body. It also reduces heart rate variability, which is again a surrogate marker for increased stress and increased cortisol level. People they've all these meditation centers or organizations like Art of Living and the Transcendental Meditation Center, all these places have even done a lot of research to show that the cortical gray matter thickness, which is where the maximum density of neurons or nerve cells is, that increases when you meditate regularly. So that increases attention, focus, memory, judgment, behavior. All of those things are benefited by meditation. And we have enough data to show that it works.
You also mentioned amygdala earlier in the episode.
Yes, so amygdala also has a role to play. It processes fear, and it processes strong emotions like what we call as the flight and fight response. So meditation increases the parasympathetic tone of the body and allows you to better adjust with these sudden changes in emotion that you may perceive. Let's say something makes you really angry. If you're a regular meditator, you might be able to. Though I know a lot of regular meditators who lose their shit
Yeah.
at any given instant.
That's true.
So, but I mean, there's no doubt about it that it works.
Correct, right. So let's go on neurosurgeries then. Let's take a turn and go towards your surgeries. Long surgeries, especially related to the brain that you do. How do you prepare yourself for such long surgeries? How many hours does it go for on an average?
So, in the olden days, surgeries used to last really long. You'll have stories of people having operated for 18 hours, 20 hours at a stretch. And I myself have operated once for 18 hours. But most average brain surgeries don't last for more than 4 to 6 hours.
Okay.
Right from starting of the incision to closure. Again, it varies. Some surgeries you can finish in a span of 45 minutes to an hour. Some surgeries take longer, depending on what you're doing.
Are these
What is-
usually brain tumors?
They are brain tumors, yeah.
They're most of your surgeries.
So there are brain tumors, and then you have brain hemorrhages, and then you have aneurysm surgeries, you have epilepsy surgeries, you have deep brain stimulation surgeries. So again, every surgery has a different. But let's say an average brain tumor that takes 2 to 3 hours to do. Most brain tumors. Now, obviously, some can go on much longer, some may be a little shorter, but that's like a rough window. Depending on what the case is, you have to study the MRI scans in great detail. You discuss them with your colleague the evening before. You make a plan about how you're going to position the patient's head, what trajectory you're going to use, what is the approach, what is your plan A, what is your plan B, how much blood is going to be required for surgery, how long is the surgery going to take, what are you going to do? What if you find that it's not what you expect it is? Sometimes stuff like that happens. So you have to have a contingency plan. You have to have a lot of thinking about a particular case. You're not just going into the case 5 minutes before an operation and saying, okay, chalo, kholo, dekhte kya hai. So it's a lot of the times people don't see that planning. Patients don't see what goes on behind the scene, how much you're thinking about it. Every time when I drive back from work home, I'm thinking about the surgery the next day as to what I'm exactly going to do. Have I planned for everything? Have I arranged for everything? If there's something called as neuromonitoring that's required, is that organized? Is whatever, if there's a specific instrument that's required, is that available? So all those things are very, very carefully thought of and streamlined. We have an entire checklist that we go through and fill in before surgery, and these are the things that we are going to do for this particular operation, so that we are. It's like going into battle, right? You can't go into battle and say, "Abhi churi bhul gaya ya banduk bhul gaya." So it's like that.
I can buy that too, that you constantly keep on thinking about your
You're
surgeries. I can buy that when you said constantly you're thinking about the surgeries, when you said even you can't even miss a call, when you just told the team that if it's from ICU, you have to stop the podcast, and that's
because I mean now you operated on 3 cases and come here and you're recording. If something goes wrong with somebody and you're busy chatting while someone else is dying somewhere.
During the conversation, is those surgeries still in your mind?
Yeah, I'm constantly now. I have a patient who's not well in the ICU. Sometimes it wakes you up from in the middle of the night. You were asking about what causes the brain not to sleep, right? Sometimes you're sleeping, wondering what's going to happen to the patient. You just wake up with a nightmare. Whether is this patient okay? Then you'll just call the ICU to check on the patient, and they'll say, "Our patient's fine." But you're constantly processing everything that you're doing. And most people don't realize that even if you're at a party, even if you're having fun, there's one little corner of your brain that's wondering about, oh, how is this patient? How is that patient? Is that patient okay? First thing in the morning, you wake up, you check your phone to see if there's any message from ICU, if there's any scan that's been sent to you. So you dread the fact that if you ever left your phone on silent and you've missed
a call, and that's the worst
call,
nightmare.
it could be devastating.
You mentioned your longest surgery was 18 hours long. Would you
Yeah.
quickly take us through that very quickly?
I mean, it was when it was a very deep skull-based tumor encased with a large number of blood vessels, where we had to sacrifice a big vessel going into the brain, supplying the normal area of the brain, and then bypass it with another vessel, and then do a brain bypass, and then actually remove the tumor. So it was, and then we had to do some kind of craniofacial reconstruction because the tumor had eroded from the brain and through the eye and through the skull. So we involved a plastic surgeon and the ophthalmological surgeon and all of those things. So it was
Crazy.
a big deal, yeah.
Uh, During the surgeries, that might be just another day for you. Of course, you are more curious on in every surgery. You learn everything new in every surgeries, as you said. But for doctors and for surgeons, it's just another surgery for them. But for patient, that might be the biggest day of their lives, especially in the brain surgery. So
Yes.
how do you maintain that conversation when you have to say something serious to the patient which they might not like? How do you handle those conversations?
So every patient has to be dealt with a great amount of respect, great amount of patience and understanding. And every patient needs to be explained every single detail of every single operation. What are you going to do before surgery? What is the expectation during the operation? What's going to happen after surgery? And take them through every little baby step of the operation. And that you do in the outpatient clinic when you see them, when you plan surgery. Today I had a patient who came with a list of 35 written down questions of
Wow.
how long is the surgery going to take? Will I be in pain? What area of my body do I have to shave before coming for surgery? What do I eat before coming? What's going to be the duration of the operation? Will I be in recovery or will I go to ICU? Or will I be able to sit on the first day? Will I be able to walk on the second day? When will I have a bath? When will the stitches come out? So every single thing, while it may be run of the mill to repeat for you, for them it's extremely important. What kind of food will I get? Will I get an attender? When can I go back to driving? When can I go back to work? When can I start having sex? All of those things are very, very crucial to everybody's well-being and their recovery. So those who have a clear picture in their head, they recover much faster. And it is our duty as doctors to explain those details to them so that they don't come out, come out shocked. Like, let's say when we operate on the nose, we have to tell them that when we're going to put a nasal pack in your nose and it's going to be there for a couple of days and you'll have to breathe from the mouth. And so those are every single detail needs to be explained to the patient so they're aware of what they're getting into. And that way they're more prepared and they're less alarmed and they're able to go through the process comfortably. And then every day after surgery, you have to see them 2-3 times a day, talk to them, talk to the family, and guide them through till they get discharged.
For a lot of people, it is surprising that the brain surgeries are operated while the patient being awake.
Yes.
So what are the surgeries that you particularly operate patient being awake and the patient like being given anesthesia?
So there are certain tumors of the brain that are close to very eloquent areas. Eloquent means areas that subserve very important function. Let's say for speech. So if a tumor is very close to the speech area and you are wanting to make sure that you preserve that area and the demarcation between the speech area and the tumor is very blurred, then you operate on the patient awake while talking to them, asking them questions, checking their comprehension. So while you're operating, there's a separate team that's doing all that. Also, let's say if a tumor is very close to a hand or leg area function and you want to make sure that you're not damaging that particular part, you can go through the surgery while asking them to move their hands and removing tumor from the hand area. And if you realize that there's some weakness that's developing in the hand, you can either decide not to excise tumor or slow down or go to another area and then determine what kind of surgery you want to proceed with. Similarly, these deep brain surgeries that we spoke about, those patients are operated awake. Sometimes patients who have a hematoma in the head, what we typically call as a chronic subdural hematoma, those we can just operate under local anesthesia. So all those conditions are operated on upon awake while the patient can actually be talking to us. Again, certain procedures that are done for functional surgery, let's say, patients who have a particular tremor, or a musician who has a difficulty in playing a particular note on the guitar, and you want them to stimulate a particular nucleus of the brain while they're playing a guitar. So you've seen all these fancy videos of patients being brought into the operation theater, either playing a guitar or playing the piano, or certain hairdressers whose hand goes into spasm only when they hold the hairdryer and the brush in a certain position. So they try and mimic that and then stimulate that area of the brain, and that releases that particular spasm that the hand's going into at that particular time.
Wow.
So a lot of those conditions are operated upon awake.
So what do the patients feel like? Either they relax when you're saying they're playing guitar or whatsoever, they're moving hands. Are they scared?
So you have to do a lot of pre-surgical counseling. You have to explain to them that this is what's going to happen, and this is how we are going to go through it. This is the way the anesthetist is going to talk to you. You simulate it, show them the whole sequence of events on a computer. This is what's exactly going to happen. This is what you are expected. Some patients cooperate very, very well. Some patients don't cooperate. And then you have to have a backup plan of either putting them under anesthesia completely. And then we have something called as neuromonitoring as a secondary aid, where patients' hands and legs are connected to electrodes that are connected to a computer. And that also can tell us whether hand or leg function is getting affected.
Under that case, there can be anesthesia.
They can be anesthetized. Sometimes we've had patients who, really get tired talking to us through the operation. And when it's the main part of the operation, they just fall asleep when you actually want a response. So that has also happened. So a lot of things happen, but we have to have a plan B.
But what's the hardest procedure while you're operating someone?
And that's very difficult to say.
Or maybe what is the toughest case that you encountered, except that 18-hour long?
Hardest procedure can either depend, if you're not technically competent and you take up a case that is easy for someone to do, can be the hardest procedure for you. So, but tumors, deep-seated tumors are sometimes hard. Tumors in certain areas of the brain which are surrounded by nerves and blood vessels are sometimes hard. So the hardest tumors is a very blanket statement, because it depends on what you're doing on a regular basis. What may be hard for you, maybe a walk in the park for someone else. So you can't make a blanket statement that what are the hardest tumors. But there are certain challenging tumors in neurosurgery, but those are technical answers. Mainly tumors that are engulfed or encased by nerves and blood vessels. Those are difficult to remove completely, preserving function. You can sometimes remove tumors completely and have a devastated patient at the end of the day. So you may have removed the tumor easily, but you've caused havoc. So that again, but to be able to remove that same tumor without causing any neurological dysfunction is what makes it hard.
Correct. Okay, so this startup by Elon Musk, which is Neuralink, what as far as I know is they remove a part of your skull and they put a neurotransmitter there that connects to neurons in your brain. And as we are talking of January 2025, they have implanted this chip in 3 patients. One before a year, which has been the patient of paralysis. Then there is another one, and then the third one, which has been implanted before a week, and that is the developed version of this Neuralink transmitter, which is with the higher battery and more neurotransfers and all of that. So my question is it actually great for human things, or is it actually ethically wrong that what we are heading towards to with the Neuralink?
So it's basically a brain-computer interface, right? it's got superb advantages if you're able to generate a brain-computer interface that with the power of your thought, you're able to get your hand to move. Get a paralyzed or a damaged hand to move, that's great, right? If you can get someone who's visually impaired to see through the interface, then that's great. If you can get a paralyzed person to walk, then that's great. So it has great potential in compromised or diseased patients. And again, only time will tell what the eventual outcome of it is. But I think it's genius, and it's intense amount of dedication and hard work to be able to come up with this. The ethical dilemma is spoken about when you're trying to enhance cognition in an average person like you and me, if you want to become smarter. Or let's say if a sports person wants to insert it to win a chess championship, or even, for example, improve their forehand or backhand, or a spinner wants to insert it to get a better spin on the ball. Those are ethical dilemmas that you'll never get an answer to, right?
Is it actually possible nowadays, as far as we are talking currently?
I mean, if you listen to a podcast of mine 5 years or 10 years ago, I spoke about it. So I'm equally genius compared to Elon Musk. But it's possible to do. It's possible to do. We've shown it being done, right? There are certain case scenarios where people are able to function with a brain-computer interface. Animal studies have shown promising results. So the progress of neuroscience every 10 years is comparable to every single century. And now the progress we are making every year is more than the progress that we've made in the last 10 years. So with the amount of research and technology merging with clinical understanding of brain and spine problems, we are making tremendous progress. And it's a great time to live in and see where this progress eventually takes us and how we benefit from it, or what the side effects and drawbacks of that progress are.
Let's say if you are given a chance today to implant this Neuralink technology in your brain, or let's say someone close to you, would you buy that?
I would insert it in my wife's brain and keep the computer device with me. So that way I can use her as a guinea pig. But I don't know. See, surprisingly, we spoke about meditation. The people who believe in meditation, that you can use the power of the subconscious mind to do the exact same things that Neuralink is trying to achieve for cognition, for enhancing your intelligence, for being able to improve your physical and mental abilities. So that's another section of society talking about how that's possible. And you may not need the Neuralink to do it.
Have you experienced the same? You said you've done Vipassanas. Have you experienced something
Listen, I'm
similar?
a low-level fellow, man. I'm not like some...
No, but even they say that with even the basics of the meditation for a few days, you observe the change in yourself. Have you observed anything in yourself being changed?
I don't know. I'm trying. Let's just say I'm trying. I'm trying to become a better person.
Okay, let's just come back to AI and robotics. In your field, in surgeries, how much has AI developed to operate the patients? We have seen doctors in China, they're operating patients kilometers away.
Yeah.
Is that can be done with the brain surgeries now?
I don't think... See, robotics has been used in the brain quite a bit. I'm not aware of any cases of brain surgery being operated distantly upon. Robotics, actually, when robotics first came in the 80s, it was a robot was used to biopsy a deep-seated brain tumor. So neurosurgery started using robotics as the pioneering branch of medicine that used robotics, and now we use robotics in spine surgery as well to put in screws inside the spine very, very precisely and accurately. We use robotics to target certain tumors of the brain, sometimes to freeze certain tumors of the brain, sometimes to ablate certain parts of the brain. So robotics is used extensively for that. AI is just another tool that is integrated along with robotics to enhance precision, to increase the spectrum of conditions that it may be used for. So we have to really use it wisely and see to what benefit we can really use it to enhance our outcomes for patients. So it's a wide playing field, and we're definitely getting there. Maybe someday surgeons will operate on the brain sitting far away. The brain is, like you can do it on the prostate, or you can do it on liver, you can do it on certain other structures which are more fixed. Brain is slightly more dynamic. So for a robot to operate on the brain, let's say to remove a brain tumor, will definitely be possible at some point in time if it's not already being done. But you require a certain more amount of fluidity and flexibility when you're operating on the brain than it is when you're doing it for more fixed, rigid structures, I think.
Correct. We have spoken so much about the brain tumors. So let's just take a minute to spread some basic information on the brain tumors, like when you should be get checked, what are the primary symptoms or what are the preventable measures for the brain tumors?
So there's nothing preventable. It's just, if you get it, you get it. It's bad luck. Sometimes there are certain tumors that have a strong genetic disposition. So if you are aware that someone in the family has a brain tumor, then it might be worth checking or doing an MRI scan early. But let's say it's a sporadic case where the commonest symptom for brain tumors include headaches. And headaches can be mild or they can be significant. If you have a dull aching headache that's not going away in 1 or 2 weeks, I would recommend doing an MRI of the brain. Time and again, we see patients with, all they have is a dull aching headache, and they get an MRI and it shows a brain tumor. And time and again, people ignore a dull aching headache for really long until it really affects their quality of life. And then when they do a scan, it's too late.
Is there a particular part of your head that pains during the brain tumor?
It just depends on the location, depends on the stretch of the covering of the brain that causes a headache. It can be anywhere. You can have a tumor on the left side, but you can have a headache on the right side. So that's one common cause of headache, common cause of a brain tumor. The other cause is that sometimes it can present as a seizure or an epileptic fit. When the brain irritates the surface of, when the tumor irritates the surface of the brain, you can have a seizure, and that can cause a fit, and that may be the diagnosis of a brain tumor. Certain brain tumors are diagnosed based on structures that they affect in the brain. Let's say a tumor is displacing the hearing nerve, you may have reduced hearing. Tumors displacing a visual nerve, you may have reduced vision. Tumors pressing against the balance center in the brain or the cerebellum, and that may cause imbalance while walking. You may be having some kind of a gait disturbance. That may be the symptom of a tumor. So you have to be very sensitive to symptoms. I always tell people that symptoms are a gift of the body, and they should not be ignored. And it is your body's way of telling you that something's wrong. Strong emotional situations can cause symptoms. So imagine physical conditions of the brain definitely can cause symptoms, and you should not neglect them.
Correct. So I have a section on debunking myths. That's what I do in my medical podcast at the end. So there are some related to neurology, neuroscience, and neurosurgeons as well. The first being is very common. Humans only use 10% of their brain.
It's true. Haven't you met people who use much less than that?
I mean, technically speaking, is it true?
See, there's no way to prove it. But considering what we are able to do with our brain, let's say 50 years ago as opposed to now, it's definitely certain that there is so much of untapped potential in the brain that we are still able to harness. You've seen people who are able to astro travel and people who are able to channel other people who are able to see certain things that you cannot see. So obviously they are like our sadhus and our rishis, and obviously there's something in the brain that they're able to harness that makes them above the common man like you and me who just go around doing our usual stuff.
Correct.
So imagine if that so-called technology is available to everybody. We wouldn't have to bloody sit in a car to. I could be operating right now and still sitting here and doing my podcast with you.
But do you think that they're confused between the power of your mind and the power of your brain?
I mean, this is all just technical jargon. At the end of the day, it's all the same thing, na?
Correct. The second one is memory loss only happens in old age.
I mean, the older you get, definitely the greater the tendency to forget, because as we age, like our hair grays and our skin wrinkles, the brain also atrophies. The blood supply to the brain also takes a toll. So, and eventually it causes a pruning or a depletion of neurons that are responsible in memory. So definitely if you take, let's say, 1,000 people above 75, 80 and 1,000 people in their 20s, you're going to have the older people having more of a memory problem as compared to younger people. But younger people also have memory problems. And now I think primarily it's because of lack of attention. You know, everybody tries to multitask. Everybody's on the screen the whole day, which reduces the ability to pay very specific attention to certain things that we used to once upon a time. So you're seeing a large number of younger people with memory issues now than before. And I have a feeling it's related to being distracted.
Another one is all brain tumors are cancerous.
No, of course not. 50% of brain tumors are benign and 50% of brain tumors are cancerous or malignant.
Correct. Left-handed people are more creative.
Again, my daughter is left-handed. She'll be really happy to know that. Some data suggests that left-handed people have a better hand at spatial recognition, at creativity, at music, at speech. But I don't know whether it's foolproof.
Technically, when you open a brain or when
You can't
as
tell.
much as you know about the brain, there's no evidence. Okay. The last one being playing games makes you smarter.
Of course. And more than video games, physical games, football, cricket, tennis, any indulgence of any kind of sport results in a significant neuromuscular coordination, increases blood flow to the brain at the same time. And that has been shown categorically to enhance brain function.
Let me narrow it down a bit. Does brain training games on the phones or anything, does this brain training games make you smarter?
There's some data to suggest that it does. But using the brain training game on the iPad for a long time makes you dumber. So you have to decide what you're going to do. Again, see, all of these things have... I'm not a big fan of too much of research because we don't know the validity of that research, where it's coming from, what the underlying funding is. It's very difficult to ascertain for sure that what people are telling us is really true or the gospel truth, because everything we learn changes every couple of years.
Correct.
It may be true for that particular time, and then we find out stuff to believe that it's not true.
I understand. So, heading towards a bit of closing now. If you want to educate everyone about one thing regarding the brain before we end this episode, what that would be?
Use it. It's the best gift that we've been given. Take care of it. Don't abuse it with smoking, drinking, drugs. Nourish it with meditation, sport, and exercise. And fill it with a feeling of gratitude and abundance, and do whatever you can to give back to others who may not be able to benefit from it as much as you have.
Thank you so much, sir, for spending your time. I know you've been rushing today. You're traveling tomorrow,
No,
but
it's
you are
my
still here
pleasure.
at 1 a.m. That's crazy. But thank you so much.
My pleasure.